All right, thanks everyone for being out here. I talked a little bit over at the rally, mostly as my position as a physician, and I kind of hold that dear to my heart. I've been doing that more than half my life, but really here to talk to you about sort of myself as the director of a group of doctors out there advocating every single day. The Committee to Protect Healthcare is a nationwide network of over 38,000 physicians fighting for equitable, quality, affordable healthcare that protects patients and saves lives. Not a lot to ask for. We mobilize and train our fellow physicians to fight for policies that improve patient care, protect public health, and ensure access to essential services. But we also hold politicians accountable when they stand in the way of that progress. And we saw last night what happens when people mobilize and people hold politicians accountable. In New York, in Pennsylvania, in Virginia, in New Jersey, down in Georgia, the Public Service Commission. We see what happens when they screw around with our health, when they screw around with people's right to vote. That's why we're out here, because we know when we hold them accountable, we can achieve anything. We are not afraid to call politicians out when they put our patients at risk. So when politicians like Robert F. Kennedy Jr. do just that, we get loud. Get loud, everyone. Some of you might remember at the end of 2024 and the beginning of this year, as the Trump administration 2.0 was taking shape, over 22,000 physicians joined with our committee to say no to confirming RFK Jr. as Secretary of the Department of Health and Services. I actually thank Senator Markey over at the rally because he read out that document of 22,000 doctors on the Senate floor to show that physicians in this country did not support Bobby Kennedy running this department. And I think all of us here were prescient when we made that prediction way back when. And when the Senate chose to confirm him anyway, opening the door for him to throw the CDC and NIH into chaos, politicize the FDA, and spread his disinformation at the highest levels of government, we came again together to oppose his antics. As an organization, we organized thousands of physicians in a unified letter urging Congress to use their oversight power to investigate Robert F. Kennedy Jr. and his undermining of public health. And the Capitol's not too far, and we can tell Mike Johnson, bring Congress back to order, exercise your oversight responsibility, and hold this guy accountable for killing our patients. Because we are not going to stop until RFK Jr. is held accountable. Every day he's in charge of the Department of HHS poses more threats to patients like mine and to all Americans. I also host a podcast along with our Chief of Staff, Miles Baker, called Paging America. So if you're in the podcast, look it up, Paging America. And we explore the power, profits, and politics shaping healthcare. And why that's relevant to what we're doing here is that every week we record and release a new episode. And literally every week we have a new conspiracy theory or other concerning action from RFK Jr. to discuss. It's like this guy, you know, if it weren't so scary and destructive, it'd almost be humorous that he provides us with so much content in the ridiculous things that he does, from falsely claiming that Tylenol causes autism to firing the head of the CDC. It's headline after headline that represents real threats to public health day in and day out. Doctors like me see the impact he's having on our patients when they express hesitancy about getting a long-standing safe vaccine or ask nervous questions about whether circumcising their child will cause autism. I know all you primary care docs out there, you have 15 minutes with a patient and you're spending time talking about giving Tylenol to people's kids and the safety of things like circumcision. It's just devastating. And we worry that we're going to see the impact he's having on our public health infrastructure when we're facing our next pandemic and when our ghost of a CDC is not able to deal with it. That's why physicians need to keep speaking out until RFK Jr. resigns or is removed. Our patients' lives depend on it, and all of our lives may very well depend on it.